Benzodiazepines fall under the category of sedatives and anti-anxiety medications. To reduce anxiety, they affect the GABA system by clinging to the GABA benzodiazepine receptor in the brain. There are two different types of benzodiazepines. Some are long-acting and have a half-life of 40 to 100 hours, and others are short-acting and only have a half-life of 2.5 to 12 hours. Within these categories are different varieties, and different ones are better at treating different things. Doctors prescribe different benzodiazepines for treating anxiety, muscle tension, seizures, insomnia, and psychiatric disorders like PTSD to help with sleep. They also work well as a sedative. In severe cases of alcohol withdrawal, doctors may prescribe short-acting benzodiazepines in medication-assisted therapy to alleviate some of the discomfort of the withdrawal symptoms. Alternatively, if someone coming off of an opioid took benzodiazepines, they could overdose and die. Along with the danger of an overdose, the combination of opioids and benzodiazepines increases the risk of respiratory depression and death. Benzodiazepines do not mix well with a variety of other substances. It can result in insomnia, anxiety, and increased sedative effects. And as I said earlier, benzodiazepines affect the GABA benzodiazepine receptor. Alcohol actually does the same thing. Many of the problems caused by benzodiazepines are worsened by alcohol consumption. The liver is also in danger as both alcohol and benzodiazepines are metabolized by the microsomal ethanol oxidizing system. This can result in toxic levels of metabolites in the liver. Of course, benzodiazepines are not only dangerous when combined with other drugs. Older adults on benzodiazepines are about 50% more likely to fracture a hip and also 50% more likely to develop dementia. They impair short-term memory and cognitive function, cause delirium, and can lead to death by suicide. They also increase the risk of falls, which is the leading cause of injury among older Canadians. Motor vehicle collisions, however, are the leading cause of accidental deaths for 65 to 74-year-olds. Benzodiazepines affect one's ability to drive for up to 17 hours after using it. So who is in danger? Older adults in general have more pain and sleep problems, which can lead to a benzodiazepine prescription, which can lead to a dependence. At higher risk are older people that are socially isolated, don't involve themselves in stimulating activities, or don't have some sort of clear purpose in life. Older adults that use or have used cannabis are also more likely to develop a dependency on benzodiazepines or other substances. Sadly, because of the anatomical and physiological changes occurring in older adults, they are more susceptible to the problems associated with these drugs than younger people. Additionally, there are almost twice as many women using sedatives as there are men. Health Canada says that women are prescribed benzodiazepines for coping with stress, grief, acute or chronic illness, physical pain, or for adjusting to menopause or life after childbirth. So considering older women, 18.7% take sedatives like benzodiazepines, and half of them do so daily. Benzodiazepine addictions are also more prevalent among psychiatric outpatients as well as babies. When a baby is born to a woman that uses them, the baby can have neonatal abstinence syndrome and experience tremors, irritability, and seizures. Let's talk more about withdrawal. When coming off of benzodiazepines, doctors often administer doses of short-acting benzodiazepines to taper it off. Otherwise, they could experience worse insomnia and anxiety during withdrawal. That's especially true for older adults. There also exists a danger of seizures, which can be life-threatening. While tapering off of benzodiazepines, some patients also receive trazodone for sleep or carbamazepine to treat seizures. Older adults typically have a harder time coming off of any substances. And because benzodiazepines are only used a little less than tobacco amongst older adults, it's important to know how to do it right. For that reason, CCSA made a care pathway that includes education on benzodiazepine use, medication-assisted withdrawal, and interventions like CBT. A solution to drastically reduce the use of benzodiazepines is to implement interventions that promote successful aging. Studies show that successful aging is only 20 to 30% heritable. Ensuring that older people are active, social, and happy would decrease the need for psychoactive medications and thus decrease the dangers associated with them. To treat anxiety, other drugs are available that don't involve the GABA system. Concerning vehicle-related problems, more work is needed to prevent older adults from driving while taking benzodiazepines. Mandatory reporting benzodiazepine use to authorities could be more widely established, as it already is in some jurisdictions. And it's also important to raise awareness amongst doctors and the general public. Thank you for watching my presentation. I hope you learned something new.